If you're a man who values his health, vitality, and virility, this video is for you. I'm Dr. Emily Thompson, a urology specialist, and throughout my career, I've observed brave men silently facing problems that no one taught them to discuss. Let's break that silence. I'm going to share with you 10 things you should never, under any circumstances, do to your penis. I'm not talking about internet legends, but science and the authentic experience of people like you. Believe me, many of these mistakes are more common than you think and are impacting your quality of life without you even realizing it. Make sure you stay until the end, because point number 10 is perhaps the most surprising and the most important for maintaining your health in your golden years. Before we begin, if you find this honest and straightforward content about men's health valuable, I would appreciate it if you subscribe to the channel and hit the bell. That way, you won't miss any potentially life-changing information. Let's get started. Don't neglect your penis. Gentlemen, the first and perhaps most serious mistake of all is to overlook it. It's to consider its function as something separate, a matter of performance and nothing more. I completely disagree with that. The ability to achieve and sustain an erection is a reflex, a clear and sensitive indicator of your cardiovascular health. I want you to think of it this way. The circulatory system works similarly to the plumbing in a house. The arteries in the penis are some of the finest and smallest in the body. If blood flow, for whatever reason, begins to struggle to reach those tiny pipes, what does that mean for the larger main pipes leading to your heart? Yes, it's an early warning sign. A pivotal Mayo Clinic study followed men with erectile dysfunction and found they had a significantly higher risk of heart attack, stroke, or circulatory problems in the legs. This is no coincidence. Erectile dysfunction and heart disease share risk factors such as high blood pressure, high cholesterol, diabetes, and smoking. Therefore, an erection problem is not a failure of masculinity. It's a signal from your body asking for attention. It's an opportunity to avoid a more serious problem. Don't ignore it, listen to it, and consult your doctor. Don't resort to improvised home remedies. We live in an age where the internet offers quick and surprising answers to everything. As a doctor, I understand the desperation and vulnerability many men feel. They seek to improve, feel younger, and regain the energy they used to have. I sincerely urge you not to be fooled by home remedies and magical devices advertised on the internet. I have seen devastating effects in my practice. Damage that in many cases is irreparable. Men who, following a video of dubious origin, have tried dangerous manual stretching exercises, sometimes known as king on the internet. They think this will increase their size, but the truth is they're causing micro tears in the internal tissues. These tears heal by forming scar tissue, a tissue that isn't elastic and doesn't expand. The result is erectile dysfunction, painful curvatures known as Peyronie's disease, and a loss of sensation, not to mention homemade constriction rings. This is a medical emergency I encounter more often than I'd like. I recall the case of a 68-year-old man, a lovely grandfather who attended my office. He was so embarrassed about buying a suitable silicone ring from a pharmacy that he decided to use a thick metal ring he found in his toolbox. He fell asleep with it on. When he arrived at the emergency room, his penis was significantly swollen and a deep purple hue. The metal had completely stopped the flow. Neither he nor we could remove it. The fire department had to be called to the hospital to cut the metal with a special saw. It turned out to be a painful, embarrassing, and entirely avoidable experience. A silicone ring designed for this purpose is very affordable, flexible, and reliable. Don't risk such a vital part of your body out of shame or a desire to save a few bucks. Maintain cleanliness. But with caution. This may seem simple enough, but I've seen many men neglect it properly, resulting in painful and avoidable problems. Proper hygiene is the main barrier against infection and irritation. For uncircumcised men, it's absolutely vital to gently retract the foreskin every day during bathing. It's common for a natural whitish discharge known as smegma to form under that skin. If this substance isn't cleaned, it can become a breeding ground for bacteria, which can cause very painful infections of the glands and foreskin, known as balanitis. Symptoms include redness, swelling, itching, and sometimes a foul-smelling discharge. However, there's something even more important. If you experience pain or find it impossible to retract your foreskin, it's advisable to consult a doctor. This condition is known as phimosis and is not common in adults. Beyond hygiene, the inability to examine the skin of the glans penis is a risk factor for penile cancer. Although this type of cancer is rare, it frequently originates in this hidden area, and early diagnosis is essential. The most important warning is that cleaning doesn't mean scrubbing aggressively. I've had patients who, in their eagerness to be clean, use harsh antibacterial soaps, alcohol, or rough sponges. Don't do this. Penile skin is very sensitive. Using harsh chemicals damages the natural protective barrier and can cause dermatitis, dryness, and discomfort. It only requires warm water and a mild fragrance-free soap. Treat it with the same care you would the skin on your face. 4. Don't dismiss pain or warning signs. I understand that many men of your generation were taught to be strong, not to complain, to endure pain. The instinct is to minimize the problem, to think it's not important, it will eventually resolve itself. However, that silence and inclination to endure can have serious consequences for your intimate health. Any persistent pain, any ulcer that doesn't heal in 1 or 2 weeks, any new wart, a change in skin color, or blood in your urine or semen are warning signs your body is sending you. You need to have them evaluated by a professional. It could be a sexually transmitted infection, and if people over 60 also have sex and can also be infected, it could be a urinary tract infection or a kidney stone, or, in the worst case, something more serious. I think of Mr. Charles Bennett, a 72-year-old patient, a hardworking and proud man. He noticed a small sore on his penis that didn't cause him pain. He ignored it for a long time. He was embarrassed to go to the doctor for that. He believed it would heal on its own. When his wife convinced him to come to me, the sore was already a large, hard lesion. It was advanced stage penile cancer. He underwent very aggressive surgery that permanently impacted his life. If he had come to me at the first sign, the story would have been completely different, with much simpler treatment and a full recovery. Please put aside your pride and fear. Your well-being is the most valuable thing, no matter how much discomfort it may cause. A professional doctor is not there to judge you, but to provide help. Taking action is the bravest decision you can make. Number 5, maintain control and safety in intimacy. Intimacy is a valuable and beneficial aspect of life at all stages. It is connection, it is enjoyment, it is well-being. However, in any physical activity, safety is essential. I'm not just talking about preventing sexually transmitted diseases, which is still relevant. I'm talking about physical safety to prevent painful accidents. Penile fracture is a medical reality, not a movie myth, and represents a serious emergency. Like, clearly, the penis lacks bones, so it doesn't fracture like an arm would. A tear occurs in the tunica albuginea, the sheath of fibrous, elastic tissue that surrounds the corpora cavernosa, the cylinders that fill with blood during an erection. This almost always occurs during vigorous sexual intercourse when the penis is fully erect and bends sharply, usually as it exits the vagina and collides forcefully with the partner's pubic bone. The sound is unmistakable, a clear, dry pop, followed by intense pain, immediate swelling, and complete loss of the erection. The penis appears purple and swollen, similar to an eggplant. If this happens, it is a critical situation. You should go to the hospital without delay. You need surgery to repair the tear. Without treatment, about half of men who suffer from it experience permanent erectile dysfunction, painful curvature, and scar tissue formation. How to prevent it? Through management, interaction, and lubrication. Adequate lubrication is essential. Don't hesitate to use water-based lubricants. Vaginal dryness is common in women after menopause and is not related to lack of arousal. A helpful suggestion when in a relationship is to gently support your partner's hips, which can make it easier to control the rhythm and angle. avoiding sudden movements that could endanger your penis. Safety, gentlemen, is also part of the pleasure. Don't overheat him. Number 6, nature has amazing wisdom. The testicles are located outside the body in the scrotum for a particular reason. They require a slightly lower temperature than the rest of the body to operate optimally. Excessive heat is the number one enemy of sperm production and is very important for testosterone at your age. Testosterone is essential for energy, muscle mass, bone density, mental clarity, and of course, sex drive. Maintaining adequate testosterone levels during your golden years is essential for a good quality of life. That's why you should avoid exposing your genitals to prolonged heat sources. This means spending time in hot tubs or very hot springs. The same goes for saunas. A contemporary and harmful habit is placing a laptop directly on your legs for long periods. The heat emitted by these devices can affect testicular function. The same goes for cell phones. Keeping them in the front pocket of tight-fitting pants all day also produces heat. The recommendation is simple. Place your cell phone in your back pocket or in a jacket if you use a laptop. Place a cushion or pad underneath and limit your use of saunas and hot tubs. These are small changes to your daily routine, but your testicles and energy levels will thank you greatly. 7. Handle it gently. Let's talk about masturbation. It's a completely normal, positive, and beneficial activity at any stage of life. It helps release tension, help you understand your body, and maintain active sexual function, and however, the way you do it matters a lot. Throughout their lives, many men, almost without realizing it, become accustomed to excessively intense manual stimulation with a very firm and rapid grip. The problem is that such intensity and pressure are almost impossible to replicate in a relationship, whether with the vagina, mouth, or anus. What happens then? The brain and nervous system adapt to this very particular and strong stimulus. Then, during intimacy with a partner, normal stimulation feels insufficiently weak. This can cause serious difficulties in achieving orgasm or even maintaining an erection, not due to a physical problem, but rather a matter of neurological habituation. My recommendation is clear. Be gentle with your penis. Explore masturbation in a more conscious and diverse way. Always use lubricant. Modify the rhythm and intensity. Try to recreate the emotions you would experience with a partner. Focus on enjoying every part of the process, not just reaching the final goal of orgasm. Masturbation is not a competition. It's a healthy way to explore and enjoy your body. Number 8, don't smoke and take care of your overall health. If I had to choose just one of these 10 tips, it would be this. Quit smoking now, not tomorrow, not next month. Cigarettes are pure poison for your erections. Every puff you take introduces toxins that damage the delicate lining of your blood vessels, the endothelium. This makes them stiff, promotes plaque buildup, and drastically reduces blood flow. And as we mentioned, without adequate blood flow, there is no erection. Without a doubt, this isn't a possibility, it's a certainty. Smoking causes erection problems. As a urologist, I must mention that it is the leading cause of bladder cancer, a serious disease I frequently see in my practice, especially in men who smoke, but it's not just cigarettes. Your lifestyle is the essential foundation of your sexual well-being and lifespan. A Mediterranean diet rich in fruits, vegetables, legumes, fish, and olive oil significantly benefits circulation. Regular physical activity, such as brisk walking or swimming, is essential for improving blood circulation throughout the body, including the penis. And if you can incorporate some strength training, lifting some light weights, and using resistance bands. This is essential for maintaining testosterone and, of course, chronic stress. Constant stress increases cortisol, a hormone that dampens sexual desire and blocks erections. Find healthy ways to manage it. Discover how to meditate. Enjoy a hobby again. Enjoy nature. Talk with friends. Taking care of your overall health is the best and only solution for virility that truly exists. Number 9, take care of yourself. The mind, friends, is the most important sexual organ, and it can also be the most ruthless. When a man, especially after years of being sexually active, experiences a failure in the bedroom, the self-criticism can be harsh. I'm not enough. I'm letting her down. This is the end. I feel old. These thoughts are destructive, yet causing overwhelming anxiety and pressure. And of course, the next time he tries to be intimate, that anxiety will be present like a specter in the room, watching him, evaluating him. That state of alertness, that fear of failing, is precisely what will prevent him from relaxing and achieving an erection. It's a destructive cycle I see daily. Please treat yourself with kindness and compassion. Men at all stages of life experience variations in their sexual response. One day it may not work, and that's okay. It doesn't mean it's over. Sexuality isn't a race to win medals. Talk to your partner. Communication is key. Laugh about it if you can. Pressure can be a major obstacle to an erection. Accept that your body is transforming. Intimacy can transform and adjust. Sometimes tenderness, caressing, and emotional connection are far more important and pleasurable than penetration itself. Number 10, we've come to the well-known saying you've probably heard numerous times, use it or lose it. Is there any truth to this? Absolutely, and science strongly supports it. During deep sleep, a healthy man has 3 to 5 spontaneous erections. Nocturnal erections aren't just a reflex, they're a natural and essential body mechanism for keeping the penis in good condition. Think of it as a self-care program or an internal strengthening activity. Each erection pushes oxygenated blood into the erectile tissue. This blood flow nourishes the tissues, keeps them elastic and flexible, and prevents the formation of scar tissue, known as fibrosis. When a man, for various reasons such as medical problems, lack of a partner, or lack of desire, stops having erections regularly, that tissue stops receiving its training and nourishment. The consequence is that the tissue can become less elastic and less able to expand, which can lead to an actual loss of penis size, a shortening that can be as much as 1 or 2 centimeters. That's why it's essential, even without a partner, to preserve erectile function, which is also related to desire. If intimacy is avoided for too long, the brain and body begin to shut down that function, and desire can progressively diminish. Intimacy in all its forms is timeless. Taking care of your penis is, in essence, taking care of your entire life. It's a mirror of your heart, your arteries, your habits, your emotional well-being. It shouldn't be a taboo subject, but rather a health conversation as necessary and vital as talking about cholesterol or blood pressure. Closeness and connection with a partner are sources of happiness, health, and well-being in life, regardless of age. Don't give up. The benefits extend far beyond physical enjoyment. They strengthen the bond, reduce stress, improve sleep, and, as we've seen, help us stay healthier for longer. The story highlights the importance of listening to your body, taking care of your overall health, and breaking down stereotypes about sensitive issues. Not ignoring warning signs, avoiding dangerous DIY remedies, maintaining proper hygiene, and living a healthy lifestyle are key to protecting men's health and quality of life. In modern society, work pressure, unhealthy lifestyles, and ignorance about men's health are still common. Prioritize regular health checkups, avoid believing in miracle solutions online, and maintain a balanced lifestyle with a healthy diet. Exercise and stress management, open communication with your doctor and partner helps improve long-term health and happiness. If you're interested in the topic of intimacy and its profound impact on health, I've prepared another video that explores how sex can extend life. I sincerely suggest you watch it below. It's the perfect complement to today's talk. I hope you find this information useful, that it provides you with practical tools, and above all, that it inspires you to take an active and leading role in your own well-being. Always keep in mind that it's possible to start taking care of yourself at any time. Take care of yourself with the kindness and respect you deserve. Listen to your body's signals and never hesitate to seek professional help because you and your health are worth it. Take good care of yourselves.